situation of how I'm feeling for you. Ooh, girl, you're blowing my mind. Can't find the words to tell you just what I'm feeling for you. Let me lay it on the line.
Y'all know when I hear my theme music, boy, I get hyped, y'all. Ladies and gentlemen, that's some theme music. You know what time it is. I gotta let Mr. Jammin' J. Lamont sing to y'all a little bit more. Yes, y'all. You know, when you hear my theme music blowing my mind from Jammin' J. Lamont, you know it's time. So I want to welcome and say hello and welcome to everyone to In the Room on TAN TV, the African American Network, where we have a local feel and a global reach. I'm your host, Vance Bradford, along with my main man, my co-host, Mr. Philip Townsend. And let me say, our goal here at TAN TV is to discuss topics that impact our community at large, also to educate and to enlighten our viewing audience. Today's segment of In the Room is Dr. B's Buzz, y'all, one of my favorites. We're pleased to have Dr. Brigitte Bailey, who will endeavor to further your understanding and knowledge of psychiatry and mental health.
I guess we want to delve into some of the possible causes or reasons that suicide attempts over the past 2 decades have decreased for all ethnic groups, but increased for Blacks.
Definitely, it has increased for Black folks. And when you look at Black adolescents, their risk for suicide attempts has gone up 73%, whereas for white adolescents, their attempts have gone down a little less than 8%. So that's a huge difference that again combats the myth that Black people don't kill themselves or make those attempts. When you're looking at possible reasons behind there, you think about the internalization of racial and structural issues. So when I talk about structural issues, those are issues that barriers that are put into place besides just your race. So that could be policy, that could be housing, low opportunities for economic success, educational success. So internalizing just simply means that you start holding it inside. So you might be sad and depressed, but no one knows about it because it's just something that you're holding to yourself. So, so internalizing them and keeping to yourself, not talking about them, not doing things about them, increases those risks that we were talking about. And then you think about maybe our coping mechanisms in the Black community, and especially with our Black children, are less than what they used to be. We're not all surrounded by multiple generations of families helping us cope with economic issues, social injustice. So decreased coping mechanisms is another way that are probably contributing to why our risk is going up. And then you think about the system is the lack of psychiatric investment in minority communities, which it plays a huge role. If you don't have access to care, you don't have access to people who are who are culturally competent in dealing with and treating with people who don't look like them. Those are all things that contribute to, or possibly could contribute to, the increase in African Americans and Black folks killing themselves or making those attempts.
Okay. Well, Dr. Bailey, given the history of how some things have been done to Black people in the medical community, and we've discussed that in some of the previous shows. Black people have a distrust in the medical community and a stigma about psychiatric assistance. So could you elaborate on how effective would depression screening be for helping Black children at risk for suicide?
You know, the recommendation is to use some type of depression screening in all children, not just Black children. But screenings are, some are developed, you know, and maybe there's less Black folks, Latinx folks, or any other minorities that are used to norm these assessment tools. However, despite having some of the cultural nuances they might miss, Black kids are normally, they tend to have a higher rate of not disclosing when they are having thoughts about killing themselves. So maybe not talking to folks, but some of those screens, if you're filling them out, maybe you would fill out yes if the question asks if you're having thoughts about killing yourself versus you telling someone verbally that you're having those thoughts. So I think it's worthwhile and should be recommended. And as research catches up with social health disparities, social determinants of health, I think that maybe more norming of instruments that are targeted to minorities will also help.
Thank you.
Well, Dr. Bailey, keeping along with these youth, my question is, what are some of the risk factors for Black youth when it comes to suicidal thoughts and attempts? I'm sorry.
Okay, so in general, we know that for most people, including any general youth, any type of psychiatric disorder puts you at risk. So that's depression, anxiety, if you have a history, you have PTSD or post-traumatic stress disorder. If you're male versus female, we know that females attempt more suicide, but males actually complete more suicides. Then you think of the sexual minority, if you LGBTQ, then you might have issues there for just acceptance in your neighborhood. Any of your bullying, access to lethal means that we talked about. Then you think about for Black youth, you're also thinking of depression, trauma. We tend to live in communities that you have your risk for exposure for violence is up. Risk for you being a victim of a crime is up just simply by where you live. And just basically not having enough basic needs, right? Your food crisis, your housing crisis, your educational crisis, and lack of opportunities. And sometimes people think delinquent behavior is a risk factor for suicidal thoughts or attempts.
Thanks.
Wow, that's interesting. Dr. Bailey, would you talk about the role that racial disparities play in treatment of suicidal ideation or attempts?
Yes. So when we talk about disparities, we're really talking about the differences in the quality of healthcare based on race. So even if you have, even if you have money, you have insurance, you have all the access to the care that you need, just by being, say, Black, we may not get the same quality of care, and likely we probably aren't going to get the same quality of care just based on our race. So that goes into advocating for yourself, but that's what we talk about disparities, why are we given different treatments or quality of care based on our race or even based on our gender. And for us, you talk about how it plays into the treatment of suicide. So to get to treatment, you got to get the right diagnosis, especially for depression. So our Black youth could be, instead of having that sadness with depression, we talk about being irritable, and you might get aggressive. You might start having what we call those externalizing behaviors, right? Yelling, screaming, kicking, punching things. You know, you may not be punching other people, but holes in the wall, or if you're at school, you're throwing desks, right? So you get, instead of them saying, hey, this kid might be depressed, no, this kid's showing out. This kid is defiant, doesn't want to comply with what we want to do. And so they might end up, you know, being referred to the juvenile system instead of being referred for psychiatric care. So if you're misdiagnosing, you're not treating well, right? So then you think about other ones that Black youth are less likely to one, be referred for psychiatric care, and that's including even after they have had a suicide attempt, that they're less referred for treatment and they're less likely to get treatment, even if there's a desire for treatment. So there's a lot of reasons out there why our youth are not being treated, or that racial disparities plays in a role of suicide. But these are things that the mental health profession are dealing with every day.
Cool. Thank you.
Well, Dr. Bailey, like we're dealing with certain things of today's present situation, as far as like voter oppression, you know, and us as Black folks have to deal with a lot of things that you know, keeping us from getting help. So, and it seems like, you know, in this situation, you know, with our youth and suicide, can you tell us, you know, what are some of the barriers or blockades that prevent suicidal youth from, you know, getting the support that they need?
Well, some is their stigma about mental health treatment, right? They don't want their friends to say, "Hey, you crazy." You know, I know you go to that place over there, you know, mental illness. You know, what's wrong with you? So one is it might have their their fears of mental health and being teased, right? Because when you're adolescents, when you're kids, sometimes how they think about you and perceive you is more important than how your family perceives you. But it could be that they may have these thoughts, and the one chance that they bring that up to someone, it's ignored, right? You reach down to reveal to someone you are actually having thoughts about killing yourself, and they just ignore it. And then how does that make you feel? Or you might be excluded. You know, your friends might exclude you from being in their friend circle because you're a little bit different, or they don't understand what's going on with you. And then again, you might have the mistrust of the medical profession that's perpetuated if your families talk about things, or you learn about things in your history of what the medical profession has done to communities of colors. You also need to think about lack of access to care in your communities. If you have to drive 45 to 50 minutes without traffic to a mental health center, then, and especially if your car is not running well, right? Or that, you know, your gas is day to day. How much money do you have and how much gas can you put in your car? That's going to be a barrier for you to look for services. And then you might have, like, your family might view mental health in a bad way or a poor way. So again, the mental health stigma. But you also might be underinsured or no insurance. And you think about, you know, we don't like to really bring politics into our show, but the Affordable Care Act, if that was one of the fail-safe, if you didn't qualify for other insurance plans or couldn't afford them, if you don't have insurance, you don't have access. And then your only access is going to be when there's a crisis or an emergency, and you end up in the emergency room after an attempt, instead of us utilizing resources to prevent you from getting to that place in the first place. So that's a lot for your question.
No, that's fantastic. We appreciate the knowledge. But, you know, Dr. Bailey, this doesn't happen in the circle of people that I run in, but in the circle of people that Vance runs in. You know, you see people, you know, all the time that seem like they have everything that they could want or need, and seem like they're extremely happy. But my question is, how seriously should we believe someone, you know, with this seemingly everything to live for, when they're telling us that they're thinking about committing suicide? How serious should we take them?
Oh, very serious. Any threat to kill someone's self should be taken very seriously, because sometimes that's their cry for help. They might be feeling hopeless and like there is no other way out than to kill themselves. And so talking about it, they might be crying for help for someone, you know, to give them some other solutions than taking that final step. So take all threats to kill themselves, talking about killing themselves seriously. Because even despite what you project outwards, right? If you're keeping everything inside, we all know how to put on a mask for the day and act in a certain way. But sometimes it prevents others from hearing or seeing what's going on with us and becoming concerned. But once we start talking about it, everyone should be concerned about it.
Okay. Thank you. Vance, so now you know what to do in your circle.
And with that, though, well, that Phil. With that, Phil, Dr. Bailey, what should parents, or caretakers do for a child that is experiencing a lot of emotion and in difficult situations?
The one you want to sit down with your kids and you actually want to listen, hear what they have to say. You want to gain some understanding as to what's going on and how they arrived at that point. What they don't want to hear is, don't think that way. You shouldn't think that way. People who kill themselves go to hell. Then you start minimize what you're saying, right? You start coming up with reasons to say, well, no, you don't really think that way. And so their outcry for you to help is, next time they may not do it because of your response to what they're trying to tell you now. So again, sit down with them, listen to them, try to understand what they're saying. If they're talking about killing themselves in a way that won't kill themselves, but to a kid, if they think that will kill themselves, then you really need to pay attention to them and hear them out.
Wow. Yeah, that's really important. Dr. Bailey, it's time for us to take a couple of audience questions. Vance, do you have any? If you don't, I do. One question is, and this is actually an interesting question, are cultural differences important when evaluating the risk of suicide?
They're very different because different cultures may have different ways of expressing suicide and depression. Just like we talked about earlier, that Black youth are more likely not willing to disclose the thoughts of killing themselves. And they might disclose depression or that they're getting to that point by having more physical complaints, stomach aches, headaches, body aches, just aches and pains that there really is not a physical cause for or a reason for, and you've been to the doctors on multiple occasions and they haven't found for anything wrong. I know in some studies that sleep problems in Black adults who have been admitted for psychiatric care tends to be a standout for some of the reasonings for the suicide attempt. Because let's face it, if you have sleep problems, they also can precipitate or start a mental health crisis, right? So if your lack of sleep even if it's for good, what you think good things, right? Staying up late, talking to your friends, social media, it could be related to work. But over time, when you don't get enough sleep, then a lot of your coping skills and mechanisms may go out and then little things might precipitate or start an emotional crisis that ends you up in the hospital or making a suicide attempt or having suicidal thoughts.
Okay, I do want to get this one other question in. What role does social media play in Black children committing suicide?
So there are links that the more that you are on social media for kids, the more at risk you are for cyberbullying. And we know bullying is huge for depression in kids and for suicidal thoughts in kids and for even suicide attempts and completions. But you also think about that while you're on social media, you also have more exposure to all the racial violence against Black people or people in your community, depending on what your minority status may be, and then you increase microaggressions that can occur on the social media context. So all those things are super huge in playing in our children's role. So parents, monitor what your kids and adolescents are doing on social media. Just don't let them out there without some supervision. You know, kids are going to do what they want to do because that's the nature of kids. That it's our job as parents, adults, to monitor what they're accessing. And if there's things that they're accessing, be available to answer questions and help them explain and understand what's going on. So parents who are glued to the TV with our social injustice marches, our political things, sometimes that's going to be overwhelming for our kids also. So pay attention to what you're doing on social media and the exposure you're giving your kids with that.
Okay, well, supervision is so key. And Dr. Bailey, if you could supervise me in this breathing exercise that you're getting ready to do.
So we are going to, so remember, for our deep breathing, we want those deep breaths to push our tummy out, right? So this is not the shallow breath. So, you know, Mr. Townsend, I know you're tall. We can't really see your tummy expand. But these are for people in the audience. Put your hand on your tummy. You know you're breathing right if your tummy is increasing when you take in that deep breath. So our first one, take a deep breath in through your nose. Hold it, hold it, hold it, release. Breathe in. Hold it, hold it, hold it. Breathe out through your mouth. Again, one more. Breathe in. Hold it, hold it, hold it, and breathe out.
Well, thank you very kindly, Dr. Bailey. Appreciate all the information you've imparted to our viewing audience and to myself and Vance.
Yes. Oh, you know, I enjoy it, man. I'm stuck on it. Every word she says. So it's time for Dr. B's Stinger of the Day.
Today is suffering in silence is still suffering. Please get help. Again, that suffering in silence is still suffering. Please get help.
With that, I'd like to say that UT Health San Antonio is in no way affiliated or associated with the views expressed by Dr. Bailey, TAN TV, the African American Network, or any of its participants. And with that, I'd just like to say again, thank you to the viewing audience for watching. And we've enjoyed having you here at Dr. B's Buzz. And just remember, you've been stung by Dr. B's Buzz.
And before I kick in my song here, I have to say, Dr. Bailey, you know, your accessories are off the chain today. You're looking very lovely. Yes, the earrings and the necklace is working. But I also have to say, I'm going to give him didn't see that. Didn't see the wrist, okay, yeah. See, off the chain. And also, Dr. Bailey, you know, my man came.
Right.
Wait a minute, what's that, Phil? I'm finna show you some love. That silver's banging.
No. I was just going to say that possibly if Dr. Bailey could explain some of those designs, some of what that is. I see things going one way and things going another way.
And don't forget those red bottom moccasins you have on. Okay, go ahead.
Yeah, the one that I had, because I can't afford the other ones that. So this is a brief show, so we might talk about it next time. So we're gonna get to that exit music that we got waiting.
Okay. Dr. Bailey shut you down, Vance. Anyway.
Situation of how I'm feeling for you.